Have you ever had your clients tell you that their doctor recommended they be induced because their baby was too big, only to find out that the baby was 5 to 7 pounds? Well, listen into today's episode as I talk with Kate White, the founder and director of the Center for Prenatal and Perinatal Psychology, about the impact inductions or threats of inductions can have on both the mother and the baby.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everybody. Welcome to this podcast episode. And today we are blessed to have with us Kate White. Kate is an educator and a body worker, and she was a big part of APA for many years. She was a part of a Birth Healing Summit in the past, and you have been up to some amazing things since then, Kate. So welcome to the podcast. You want to tell us what you've been up to?
Well, thank you for inviting me, Lynn. I love talking with you. It's always fun from one passionate human to another about healing birth. I think we could have many little podcasts, but um,
Absolutely.
yeah. Well, I did work for EPA. I established their Department of Education in 2013. I ran that for 6 years, and then I left to create practitioner training programs. And I currently am running two organizations besides a private practice. I do the Center for Prenatal and Perinatal Programs, which is an educational institute, an organization that and houses just a lot of different educational programs that aren't practice-based. And then I have the Prenatal and Perinatal Somatics Institute, which houses a lot of little bigger series of training programs. And my passion was to begin to train people to prevent and treat birth trauma. So that's what I'm doing a lot of now, as well as designing other ways for a variety of health practitioners to understand what the early layers of trauma are, how to prevent and treat them.
Awesome. And Kate, I remember your interview from way back when and just how much we resonated with each other and the work that we were doing in the world.
Yeah.
And so I'm so glad to have you back. You will be a part of this year's Birth Healing Summit. We'll talk about what you covered then. But in this podcast episode, I can't wait to dive into this discussion on inductions and what the implication and results are for both baby and mama when someone has been induced. Because I don't know about you, but I am definitely seeing an increase in the number of mamas coming into me telling me that they've been induced. And I think a lot of that is coming from the ARRIVE study that happened back in 2018. And
Yeah.
so what are your thoughts on induction?
Well, like you, I feel concerned about it because I mean the ARRIVE study was if marginally conclusive, at least from what I've read, not really a big deal to help people, but it became established and
Mhm.
became a thing.
Yeah.
I see parents also threatened with induction for other reasons, for like your baby's going to be too big or you have advanced maternal age. That's in
Yeah.
air quotes. And I also, see a lot of real good reasons for induction, like preeclampsia, eclampsia, and I've seen a wide variety of conditions that come through. And I feel like induction is connected in somewhat with informed consent. Like people need informed consent, and that I see it not really well in terms of what I read and what I hear with my families that come from birth trauma. People don't really understand the implications of induction. So,
I feel like they're kind of getting a one-sided story of it. And so that's why I hope that we're going to dive into more of the other side of the story of what's really happening when someone gets induced.
well, so I feel like there's a lot of different ways to induce a person. And so I listen when people come with their story. And the hardest the hardest ways for induction, in my opinion, are Pitocin. And I think that seems the most popular one.
Yeah.
I like it when I hear my provider tried the Foley bulb, or they inform me on all the different kinds of consent, all the different kinds of methods that we can use, and we agreed on, these methods. Sometimes I see Cytotec, also is very popular. And it depends on if the water is broken or not. So, I mean, there's so many things that go into induction. And as you know, once they get into the induction with Pitocin, that there's often an epidural involved. If the baby's not ready to come, there can be a lot of other things like mechanical or surgical interventions. And so we like to say the baby will be born when it's ready. And so really,
Ideally.
yeah, and having parents feel like they have to brace or protect themselves in the face of the medical establishment, I think is super hard for them, and they don't know what to trust.
Yeah.
So, but I can speak that some people absolutely needed the induction to help with
Mhm.
what was happening. But I do see a lot of we need to induce you because of all these reasons. And then there's a lot of sort of other interventions that come into play.
Yeah. And a lot of times I just wish more parents knew to ask the question, what happens if we wait?
Yeah.
You
Yeah.
know, like to really understand their options here. And this conversation has taken me back 25 years ago when I was delivering my first one, and my water broke and I never went into labor. And I'm thinking back now, and I didn't get a choice. They're like, this is what we're gonna do. And I didn't know anything differently at the time. But I they don't give you choice. At least in my experience, there's not really this choice. It's like this is what we do.
That's right. Like when people come in with their stories, I often say that you got involved and this is how we do it, again in air quotes.
Yeah.
And so that gives sometimes parents a lot of relief because they think that it's their fault, all the things that happened,
Mm,
when it was just a consequence of some of the dynamics from their baby's perspective and from their uterus and their body and the support that they did or didn't get.
yeah.
Now, the hospital has policies on premature rupture of membranes. Is that what happened to you?
Yes.
Um,
Yes. Yeah.
So most hospitals are 12 hours. Is that without going into
Um,
labor?
they were gonna ask me because my water broke in the middle of the night, and so I didn't sleep that night. And they wanted me to come in at midnight that next night, and I'm like, hell no. I'm like, no, you're looking for a fever. You're looking for this. I'm going home. I'm sleeping. And then, like I'm not going into labor with 2 hours, 2 nights of no sleep and bringing a baby into the world. So I was fortunate enough to be able to advocate for myself, to say, no, that's crazy.
Yep.
And it was over 24 hours before, but everything worked out fine. So.
Did you get induced though? Did you have
I
to have?
did. I did. But what was great about my experience, I think they tried the gel, but it didn't really do anything. So then they did Pitocin, but I do remember them like turning it off. So the Pitocin was just enough to get my body to turn into doing its own thing. So
Okay. All
yeah,
right. That sounds just good.
yeah, yeah.
Adjust use of Pitocin. There you go.
Well, and what's coming to mind here for me is when last year when I interviewed Gina Mundy, she's a lawyer who wrote a book on childbirth, how to have a safe childbirth, because she works with hospitals when childbirth doesn't go right. And she was saying that one of the biggest issues is Pitocin, the use of Pitocin. And when we've got an inexperienced nurse just jacking it up and not really paying attention to the signs and symptoms of what going on, and that's what gets babies into trouble.
Yeah.
And like I shared, they actually turned it off, or they turned it down, and then it was off because my body took over. And-
That's a good story, Lynn. I mean, that's a happy story.
right,
And
yeah.
um and that's a good use of Pitocin. which
Right.
I
Yeah.
love the just uses or the judicious uses of some of the chemical interventions.
Yeah.
Um, but one of my favorite books on induction is called Why Induction Matters by Rachel Reed. And
Okay.
it's a little book that is published in a series called Why It Matters, and it's connected to birth. And then they print it in the UK. It's a great little book. And I have a nice quote from her that I love to say to my students when I'm training, which is if these talking about induction, it has to be shared decision making. Um, she says often that people have the legal right to accept or decline medical recommendations. People must be not be coerced or threatened into making decisions, and there must not be any misrepresentation. If these standards are not met and a procedure is carried out without consent, that action is considered assault and battery according to law.
Wow, that just gave me the chills.
Yeah, doesn't that give you the chills? Because a lot of parents are just caught up in how they do it, right?
Yeah. Yeah.
And then they are hurt, they're traumatized, or they just feel injured by what happened, and then they come into my office
Yeah.
wanting to heal, and so I can name for them, what happened and help them feel like they didn't. It's not really necessarily anybody's fault, or
Right.
it's not their fault. They just got caught up in what the policies of the hospital, and maybe they weren't told them, maybe they didn't remember them.
Yeah.
But I really feel like helping them understand what happened, is my job.
I that the coercion that happens
That's right.
with the hospital and the hospital's policy. I just did an interview with Dr. Michael Hall, who is an OBGYN of over 4 decades, and he's been delivering breech babies for all along. And he really gives a good understanding of what happens financially for hospitals with birth. And so I invite everybody to tune into that for the Birth Healing Summit. His interview will be a part of the summit this year.
Oh, nice.
Yeah, but it actually, I had it wrong. I thought it was because I thought I had it one way, but he explains it a whole different way. So I found it very, very interesting. But it supports why they're pushing the inductions.
Oh, is there like a one-liner that you can like
Well,
summarize?
it comes down to money.
Oh,
It all comes down to money, time and
well,
resources.
that's really sad.
It is. And so I think that's, when we're working, this, we're talking about pregnant mamas, because inductions usually happen. And yes, we're dealing with the aftermath of that experience. Yet when we're working with pregnant mamas, I am constantly helping them to understand the system of what they're choosing to give birth in, depending on where that's at. And typically it's just the hospitals, and understanding their policies, and that they have choice. And just like that quote that you said, can you read that again? Because that really just gave me chills. And that is so
Yeah.
important for us to keep in mind.
Okay. So this is around informed consent. And there is like a lot of ways, not just with induction, but other
Yes,
other things that
yes.
happen. Um, they say that induction, it is a challenging part of birth practices. It requires shared decision making and informed consent. So people have the legal right to accept or decline medical recommendations. People must not be coerced or threatened into making decisions. And there must not be any misrepresentation. If these standards are not met and the procedure is carried out without consent, that action is considered assault and battery according to law. I
Again, it
know.
gives the chills, yeah. And so that informed consent, just really helping our clients to understand that they should have this ability to know the pros and cons of every choice that they make in birth. And helping them to understand the policies that the hospitals that they choose to birth in, and what's behind those policies.
Right. They need to inform themselves. And that's
Yes.
kind of where sometimes the trauma is like they weren't informed, or the policies they weren't told. There are other things I've seen that surprise people, like the Pitocin afterbirth shots, or how they handle hemorrhages, or
Yeah.
they're advocating for yourself. I've seen very few that of people who tried to advocate. Often they're powered over as well. So there's a lot of power over in terms of the birth trauma that comes into my office. And I found that if parents are included in decision making and not coerced or controlled, that there often isn't trauma, even if there have been horrendous things that happen.
Wow.
So this person, Rachel Reed, has written a pretty good study done in just Australia, but it could be other countries. But she listed reasons why there were birth trauma. Mostly it had to do with the relational aspect between the
Yeah.
birthing parents and the staff. And it often boils down to little statements, big statements like your baby will die unless you do this, or
Right.
and when I talk to providers, they also feel like they're not given really good guidelines sometimes about how to communicate with patients or birthing parents. And
Yeah.
then they feel like they're often caught in a bind, and they try to figure out how to be in relationship with the hospital, the other staff, and the birthing parent. So
Wow.
it's very complex.
Yeah, yeah. It's a system though. It's a
Yes.
really a system, and everybody is trying to toe the line for their role in that system. And I just think we need to educate our parents and let them know about informed consent. And I love just asking what happens if we wait.
Yes. Well, yeah, it's a very good question. The other thing I wanted to say that I learned from Rachel Reed is in decision making is called the Brain Guide to Decision Making. And so that's an acronym. It stands for benefits, risks, alternatives, intuition, and then now or nothing, which is a part of like, do I choose this now, or do I choose nothing? And that it's very well, it's a nice framework for parents. Um, they need to ask about the benefits of induction. They need to understand the risks and on kind of all of the different kinds of ways that people can be induced. And then what are the alternative options?
Mm.
And then what does your intuition tell you? Which
Yes,
is a big deal, because I mean, your intuition told you I can go sleep and then go the next day and then get a little bit of something and then it will go. I mean, there is an intuitive sort of feeling in there, and a real agency that you have, Lynn.
yeah.
So, but
Well,
a
but
lot,
I also work in the medical field.
you're a physical
Yeah.
therapist, yeah.
Yeah, so I understand the system more than say a layperson does. So that helped me a lot.
Yes, you're empowered, and I'm sure that people could feel like we better not challenge
Yeah.
this person because they know what they're doing. But also it's like really helping. Sometimes people are induced, like the physician will just do a sweep, membrane sweep without telling them. And I mean, it just seems a lot of providers just, I don't know, have their way of doing things.
Mhm.
And um, then before they know it, their patient or the birthing family, they're caught up in something
Yeah.
without their awareness, and that's where trauma happens.
Well, I love you said this earlier, Kate, that it truly is trauma is it happens when the connection, the relationship between the provider and the patient is lost.
Yes, there's a way that the person, the birthing people, couple, are not given like shared decision making. And in our training, we have a story that my midwife partner tells where, I mean, they ended with a C-section, this couple, but all along the way, they were given shared decision making. Um, and they didn't feel that trauma. Now, some situations are emergent, like you're not going to be able to suddenly have a moment where you can go through all the benefits and risks. That's why informed consent should happen before birth about all the things.
Right.
And
Well, But I also think, as you're talking there, I'm thinking of the mom who's like, baby's crashing, doctor knows we've got to get this baby out ASAP. They don't have time to sit there and talk to the birthing person. It's like we got to do this. But yet, I think the repair could be so much better if the doctor would come back afterwards
Yes,
and just explain their actions to
right.
the mom and help
Yes,
them understand. Like,
yeah. Why
I'm
don't they do that, Lynn? I mean, why don't they do that?
well, you know what? I think a lot of it is two things: time and the fear of being litigated, the fear of
Yes,
being sued. It
right.
is so great, but yet, and they're probably talked out of doing that from the hospital policy. But yet, I think that is one of the biggest things that would cause someone not to sue their doctor.
I agree. If they could come in with compassion and empathy, and some
Ah,
providers do. I mean, they
yes,
really do may take the time. And I feel like the midwifery aspect, if we had more midwives, basically I've seen study after study that claims that if we had midwives, that not that a great degree of trauma would go down, mostly because of the relationship. And so I feel like I would love to see more providers help their patients make sense of what happened. And
yeah,
often that's what happens is they come in
yeah,
and they're very confused, and then we explain kind of what happened,
yeah.
um, and that they get caught up in how they do it, and where are the sore spaces, where are the sore thoughts that about their birth, and then that's where we apply our skills to help them integrate. And they can often do it in one or two or three sessions. It's really remarkable to see how well, they do with these kinds of things. So,
Yeah. What is besides the traumatic piece, is there a more energetic piece that is happening to mom when she's getting induced that you're
and
aware of?
well, I can tell you that it can be energetic. I don't, I can tell you that a lot of people get shocked when they're told that their body's not doing something. And
Yeah.
that's like the first thing that happens. Like what?
Yeah.
Or confusion. Like why am I not effacing? Why is my baby not coming down? Um, how come I have no signs of labor? I mean, there's a lot of anxiety. So helping people understand their body and also what's going on for the baby. Um, So I
What
think
is,
that's
what is the impact for babies with
okay.
induction, do you feel?
Yeah, I have a list.
Awesome. Let's go there.
All right, so let's see. From the baby's perspective, uh, I have reasons for induction here too. Um, so the first thing that for babies is that time, and then for parents also, time is a trigger. Like you haven't had the baby by 39 weeks. There's a problem. Time is a trigger. And so parents are under a lot of stress if they say no, I don't want to be, or you're advanced maternal age, you have to be induced by 41 weeks and 3 days. And whatever the rules are. And so now that the closer they get, the more anxious they get. It doesn't help their body or the baby.
Yeah.
And then for the baby, they can also feel like, well, they're not ready to be born. So then their authentic impulses have been overridden. And so they get lost. And later on, the pattern that sets in is, how do I find my way? And how do I make a decision? And I was once um, at a school. I was out in Seattle teaching at Antioch University, and I had a young student put up her hand and say, "Well, what if you're induced?" And I said, "Well, there's two things I've seen happen for people who, I mean, then they grow up and they have this in their history or psychology wise." And I said, well, usually there can be a big resistance when people suggest things, like there's a lot of no in their system.
Mm.
Or they can be compliant with what needs to happen, but feel very lost and not know how to find their way. And she burst into tears and she said, I'm in therapy for that right now. She was all of 20. Um,
Wow.
so
Wow.
that can be just the early layer. But
Oh,
then the other things I have on my list are feeling powered over. So like I said, it can create the fight response, or it can create a collapse or disorienting response. Feeling disempowered, um, feel that authentic impulse and pace are interrupted. So then people are often rushed.
mm,
So the rush can start here, and then can keep going with family dynamic or life in general,
yeah.
because you got to be pushed to do rush, rush, rush. Um, Tempo can feel pushed, and especially at the completion of anything. So like you have to rush. And then inductions and augmentations can really be necessary. So often there can be coupled with other things. So it can be complicated. Uh,
Yeah. Wow.
that's my list of
Yeah. That
things
I
that happen.
So Kate, with the Arrive study, to me it feels like I'm definitely seeing more and more inductions happening in my practice.
In Denver.
Yeah.
Yeah,
Yeah.
yeah. I
And
here I see them all the time as well. I didn't notice an increase.
yeah. But and maybe I'm just becoming more aware of it because I've been talking more and more the last 2 years about all this stuff. With the Birth Healing Summit focused more on the pregnancy aspect of things. And so here we are, we're going to have this whole generation of children lost.
Well, there'll be fight a fight response. So,
Yeah. So, yeah, but yeah, like their ease and their way in the world is going to be one or the other, a collapse or a fight.
right. So, I mean, I think that the healing is, how do you help somebody find their authentic impulse? Like I have my list of things that heal here. So one of them is teamwork, like helping people connect and find support to find their own way. Something called harmonic resonance, which is creating a coherence. These are all things I work with families.
Uh-huh.
Mutual support and cooperation, which is you don't override your own sense of what it is you want for yourself. And many people just do. They just override because that's what they've learned, is to
Yeah.
override.
Eh,
Um,
Yeah.
and yeah, and just a lot of connection and coherence, like feeling your own sense of ease and flow. And those are the things that I really help families with, because often people, the babies will have their own dysregulation from what happened at the birth. It's not just induction, it could be other things too that are stacked.
Yeah.
And then you really have to help them, like identify all the things and then integrate. Shows up a lot in transitions. So how people go out the door, come back,
Uh,
how children go to daycare or preschool or school and come back, and how they go to bed. So I do a lot of work with transitions because induction is where often the whole sequence starts.
wow. Well, and that's great to know. And I just want to reiterate this for everybody listening in. No matter how you're born, no matter how your children are born, there's always the ability to repair.
Yes, yes. And then I can help parents understand, like, not every baby has adverse reactions to all the things. And sometimes that's, if you explain to the baby what happened, which is what I help parents do, babies will be like, oh, really? Okay. All right.
Yeah.
I mean, I find babies to be very forgiving. I don't know if you work with babies too, Lynn,
Just a little bit, not much.
but
But and that's the one thing that I tell all my pregnant clients is no matter what's happening in the birth process, keep talking to your baby. Let your baby know. And I tell my mom like, okay, if you're getting evicted, that's what's happening to the baby. It's getting
yes,
evicted.
yes,
And so if we can talk to it and say, I know you might not be ready to come on out, sweetie, but this needs to happen for
Right.
whatever reason, right? What's your
Well,
thought?
the whole hypertension thing that happened in our country, like with the Olympic athlete that died giving birth, and some of the whole challenges of eclampsia, preeclampsia, and helping parents understand what that is, why, and the damage and that life-threatening parts of the eclampsia. I think, but I have a list here of reasons for induction that I can read also.
Okay.
Um, and they include diabetes, sometimes gestational diabetes, sometimes not. So it really depends on on what the practitioner is tracking in the birthing parent.
Yeah.
But then post dates, and that can be tricky because I mean some parents are like, I know I want to go and wait, and some really anxious providers are like, no, you have to be induced,
And I just say some mamas are 42 weekers. You
right?
know,
That's
some
true.
people are 42 weekers. That's how long they gestate.
Yeah.
So, yeah.
Yep. And then I have intrauterine growth restriction.
Yeah.
Maybe there's small or large for size, size, and then there's insufficient amniotic fluid. So
Yeah.
that could be really tricky, also scary. So for parents, like, what does that mean? Or a non-reassuring stress test, a non-stress test.
Yeah.
And then decreased fetal movement,
Mhm.
or premature rupture of membranes or pre-labor rupture like yours.
Yeah.
Then there can be induction success. So this is all sort of in the medical literature. And if you're younger or you've had babies before or your BMI is, a certain number, or the birth weight of the baby or your cervix is already ripened, these are things that will help with inductions.
Well, something that comes to mind to me though, hearing that is that so much of that is based on like our ultrasound imaging. And I just keep hearing over and over. I hear more of how that ultrasound was wrong than it was right, and that it's wrong in it was too high. Oh, your baby's too big. Oh, you've got a 10-pound baby in there and they deliver an 8-pound baby. So I,
Yes.
what I try to do for my clients, my pregnant clients, is to help them to tune into their own body, their own baby, and really try to trust their intuition of what's going on, balanced with the information they're getting from the medical team. And if they're really, because I have mamas that are like, "Ah, I feel like everything's fine. I feel like my baby's fine,
Yeah.
but
Yeah.
yet they're getting all this pressure.
Yeah.
And then I tune into their body and make sure that when they're saying everything feels fine, I feel that resonance in the body tissue as well, to to just try to
Definitely.
give them a little bit more reassurance, or affirm to them what they already know.
Right. Right. I agree. I mean, really helping parents settle. Now,
Yeah.
I have a wonderful new birth story about induction that I
Okay.
have permission to tell. Maybe
Okay.
your listeners. Let me just find it because um, this person was advanced maternal age, and so a lot of couples will get pressure to
Yeah.
be induced because
Yeah.
they're a certain age.
Yeah.
Um, so she was 41, so it's not so advanced for maternal age. I had my second baby at 41. I now was never pressured, so I don't know where this comes
Yeah.
from now. But
Right.
at 39 weeks, she was began to be pressured for induction. And it wasn't her provider so much as everybody around her. She had a medical providers as parents and
Right.
parents-in-law, and there was a lot of pressure, even from her girlfriends who were nurses. I mean,
Um,
it's in the culture now, so you should be induced. And
yeah.
so she wrote to me. She had gestational diabetes, and she goes, "I have to see you. I have to see you." I'm like, "Okay, come in." And it turned out that she had this high amount of anxiety. There was all this pressure, and then she didn't. She felt like you said, "I think my baby's fine," and so, but she was so shaken. Um, so what we did was we had a lot of sort of down regulation of the nervous system. So
Hmm.
I used touch. So I did some of that. We created a space, a safe space around her with her imagination. And how does it feel to decrease the fear? We went toward the fear. I just did the somatic experiencing like work to decrease the fear. And then I had her put her hands on her baby. And I put my hands on her hands. And I just had a conversation with the baby. So we talked to the baby, talked with him about maybe coming when he can to avoid any more of this pressure.
Yeah.
And then so he wouldn't be forced on a path that wouldn't be peaceful. And then we communicated with him out loud. Yeah, and we just did a lot of I did a lot of validation of the what was happening. Yes, that's hard. I had a lot of empathy for her. She said to me what really helped besides talking with the baby, which she loved, because he participated by kicking, stuff.
Yeah.
Um, she said it helped her to get out of the fear state and into her body. She said what she called it was she was facing a timeline. And
Mm.
so she emailed me or texted me a few days later. She had her baby 2 days after she came to see me,
Oh, yeah.
and he was not big for, I think he was 8 pounds. Yeah, 8 pounds, 8 ounces. And he was, yeah, yeah, it was it was fine, a fine birth. So,
Great. And no induction. Baby
no
came
one,
on its own.
yeah.
Oh,
And all around her were these people who had had inductions and C-sections. So she was afraid of that. And
yeah.
so by decreasing the fear, feeling supported, talking with her baby, we were able to, step out of that, and she had a natural birth.
Awesome.
I think it was a fairly fast birth too. I don't have my notes on how fast it was, but she said it was very good.
Oh, that's so awesome. Such a great story. I remember back when you were a part of the summit, Kate, your story, it still sticks with me to this day when you were trying to help a baby turn that was breech and you rang a little bell by the vagina opening and say, turn
Yes,
your head to the bell, turn it to
yes, yes.
that. We can talk to these babies, everybody. We can
Yes,
talk to
yes, you
them.
can talk to babies and help them understand what's happening and encourage them to come sooner, to find their own authentic impulse. What we say to babies is that you can be born when you are ready, and to help parents really wait or feel secure in waiting or to really feel like down regulating the fear and how to really be with themselves. And she had gotten herself into a really high state of anxiety, mostly because so many people around her
Yes,
were pressuring her. Not just her provider wasn't as much. Um,
interesting.
it was interesting. So
And
yeah,
what was so beautiful about your story there is helping her to down regulate and clear away like the as you were talking, I see it's like clear away everybody else's energy from your field and get rid of their input and let's just be with you and
yeah,
see what you want and how your baby is and when we are in that fear anxiety response, we're tight and tense
yes,
and we
yeah.
can't relax to allow baby to come on out.
Right. Right. So that's what we did. It
Yeah,
really, I have a lot of questions I ask people that will build a coherent, relaxed state. And one of
right.
them is what helps? What helps you? Tell me more about the things that are meaningful to you. And as I listen to them, I sort of lead them into feeling into their body. I think that's what I did with this woman, Ashley. And
Um,
yeah, and I
yeah.
think it was exciting for her to talk about other things besides her fears. And
Right.
we
Which
were
just
able,
creates more fear and anxiety.
yeah, yeah,
Yeah. What we focus on expands, everybody. I'm sure you all know that. So,
yeah,
wow. Kate, this has been amazing. Thank you so much. I hope people got a broader understanding of what really happens. I mean, yes, inductions can be necessary. And I do feel a trend that the medical field is just oh, let's just induce, thinking that it's not a big deal. But I want people to understand that actually it is a big deal to the baby and to the mama, especially if she's getting coerced and bullied into
Yes.
doing it, and
Yeah.
not having the full informed consent that they need to make the
Well,
best.
yeah, my advice to parents is do your due diligence. Prepare for everything. The
Yes.
midwife partner that I work with has variations on normal, and just really make sure that parents, you do your informed consent, and do like have providers that are really honest and truthful, and do look at all the things that can happen and take them into consideration as you're preparing for birth.
Yeah. So important. Yeah. Thank you. Thank you. Thank you. Thank you. So, Kate, you're part of this year's summit. Can you tell us a little bit about what we talked about and what you're sharing in the summit this year?
Well, yes, I talk about my approach. I talk about the three first steps I often use with birthing families, and I talk about the work that I've developed with my midwife partner. And so it was a chance just to talk about what those how we look at what happens for parents, and so I have layers of experience. I help people identify the layers. Um, and then we work with like developing ways to, for me, it's prevention and treatment of birth trauma. So,
Oh, it was such a great interview and such great information about really working with birth trauma and preventing it in the first place.
right.
So,
Yeah.
everybody, check that out. Please join us for the Birth Healing Summit this year. Starts April 7th. The doors open end of March. So, look forward to that. Put it on your calendars, and you don't want to miss out on this one because it is a good one. It is a good
It
one.
does sound great. It does.
Yes. Yeah. There's so many good pieces that I've already picked up and have started implementing in my practice. And I'm just so, so grateful to you and all the other speakers who have agreed to be a part of this and share your wisdom with us. So thank you for being on the podcast, Kate. Thank you for
Thanks
all
for
the
having me.
amazing work that you're doing in the world. And we will see you, everybody, on the next episode. Take care, everybody. Bye bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.